Thank you for that introduction. I am thrilled and excited to be here because of the work of IOM, and especially want to thank Lila and Drew for having me, and the planning committee, Garth, Linda, Suzanne, Jillian, Pamela, and Andrew. I've learned so much from you about health literacy, and I'm confident that together we can do what we talked about in the introduction, is that to provide a collaboration for the academics, for the researchers, and for the industry of apps and wearables to come together and find that common mission of helping people live healthier lives. So I want to give you a little bit of an introduction. Why am I here? Why am I leading off today's presentation? So a little bit of a story. I am a graduate of Penn State in exercise and sports science. I recently went back into academia and got a master's degree in international business from the University of Limerick in Ireland, focusing on entrepreneurism. And I wasn't ready to come back to the US, so the Irish government suggested that I could stay on to do a PhD in a topic of any of my choosing. So I chose to create a degree in the School of Engineering, which combined two of my passions, exercise science and technology. So I am finishing my PhD in consumer-facing digital health technologies. Some would suggest that my claim to fame is that at the age of 24, I started my first consulting company, and the White House was my first client. So my old offices are just a couple of blocks down the street. And it was at the White House where my passion for digital health really came to the forefront. I was there to manage the entire health and fitness for the president and his staff, but I had a few members that wanted me to travel with them wherever they went, and I said, I can't do that. I need to stay and help everybody. So I needed to find a way to eliminate the 4 physical walls of our fitness center and to become virtual. In 1999, I got a phone call from Osram, Sylvania in Hillsborough, New Hampshire, asking if I would like to manage the facility there. And I said, I'd love to, but I can't move. So as my company grew, I needed to find a way to be virtual so I could use the examples from the White House, but to expand those as I continue to grow. So that's where my passion and my interest in this type of technology came to fruition. So from a personal perspective, but also from a business perspective. So today, what I'd like to do is to talk about this question. Can consumer-facing digital health technology really help people live healthier lives? Before I begin, we talked earlier about the Fitbit. I have one on. Anyone else have a Fitbit in the room today? Great, we'll become Fitbit buddies afterwards. But there's a certain fear of using this technology for certain people. There is a certain energy of using this technology by some people. So hopefully by the end of today, we will be able to find a solution that we all can use, that we all can adopt, and we can take back to our own practices. This area is so new and in flux that there is great opportunity. There's even greater potential to leverage this technology. So the question becomes, how do we best do that? So let's first define, for me, what consumer-facing digital health technology is. If you look at any academic research, there are a lot of synonyms. One suggested there was over 200 different synonyms. It can be anything from e-health to m-health, gamification of health, big data, even quantified self. It's a daunting task to try to define for the rest of the day what it is that I consider digital health. So for me, it's these 3 areas. It's apps, wearables, and websites. So let's take a look at a few. This is an app called Fuducate. If you, we all know the barcodes on the back of the products that you buy. This app connects to a database, and it gives a score, a health score, for the food that you're about to buy. One of the things that I've seen parents do with this type of app is they use it as an educational moment. So in the grocery store, the child brings the food back to the parent, they scan it, they see what the score of the food is, and they can make better health choices right then and there when they are purchasing food for the family. This is one that I used as part of my PhD research, and that is a fitness tracking app called Runkeeper. You go out for an exercise, you start your app, it's connected to GPS, it can show you all different sorts of things, time and distance, and when you're done, you can share this workout with your social network. I'll tell you a quick story on the side. As I lived in Ireland, my brother lived in DC, and he ran his first DC marathon. And he used an app similar to this, and it connected it to Facebook. I couldn't be back to cheer him on like I wanted to, but every mile when he ran the DC marathon, it posted his time and where he was on Facebook. When I replied to that post, he heard a cheer in his headphones. So even though I wasn't here, I was here. And there's another app that's quite interesting that not only did you hear a cheer, but he could have heard my voice. Hey, Tim, great job. Keep it up. That's something that we couldn't have done 5, even 10 years ago. So it's interesting to see where we're going in this. I recently, in the last year, have been having migraines. And I said, it's time to live what I'm studying. When you have migraines and headaches, the physician says, I want you to track everything and we can talk about next time that you're in. I'm not a very good person of journaling and writing these things down, so I found an app that did it. So I could track when the headaches came on, the symptoms, things that happened beforehand and afterhand. And what I was able to do was then to go in and to have a more educated discussion with my physician about the headaches. Let's take a look at some of the wearables. This is one you may not be familiar with, but it is a tattoo for diabetics to track insulin. It's flexible, easy to wear, and extracts and measures the level of glucose in the fluid between the skin cells. Or this one. Those of you that have used heart rate monitors in the past with the chest straps, this is one from a company called FitLinks. It's the size of a Band-Aid. It does the same thing, and you put it on your chest where your heart is, and it transmits your heart rate not only to your mobile phone, but also to the exercise equipment that you're using, so you can see that interface. And many of you probably are familiar with this picture and the Apple Watch that came out just a few weeks ago. I'm excited about this, but I'm also concerned. The price point is $350. So perhaps we in this room can afford it, but what about the people that can't afford it or can't understand how to use it? What can we do to help them? So that's what we'll talk about here today. And there are websites. You may be familiar with this website called Patients Like Me. And they are committed to putting their patients first. They do this by providing a more effective way to share real-world health experiences in order to help their users and other similar users to connect with organizations that focus on different health conditions. So if I had a rare disease in San Diego and there were others in Boston that had similar symptoms, I now can have this interface. Now I do realize that some physicians, some health groups may be nervous about what this does to the quality of healthcare, but it's happening. So how can we be part of that solution? You're probably all familiar with websites like WebMD or Dr. Google. If you're a physician, how many times have your patients come in and said, I found out on the internet that I have such and such. So people are going out and they're using this technology. And the federal government using websites to provide that type of information. I found this quote to be quite striking and quite interesting, and Bernard talked about it a little bit earlier, and I apologize that you're missing part of it, but it says, digital health innovation takes longer than you think and happens faster than you think at the exact same time. Unity Stokes is a founder of Startup Health, whose mission is to help health startups to reimagine and transform healthcare over the next decade. They believe that entrepreneurs have the collective power to build the future of healthcare and enable them to develop the leadership, relationships, and industry intelligence to succeed. So we're seeing these startup incubators all over the country, all over the world, coming together and trying to find out how can we create that better mousetrap for healthcare. So let me share with you some statistics that I find quite interesting with smartphones. We keep our phones within arm reach 91% of the time. How many people this morning woke up to your smartphone as the alarm? How many people have already checked email on the smartphone? That's almost everyone in the room, hand goes up. We are tethered to our smartphones. And if you think back, the smartphone came out, well, iPhone, 2007. That's not a long time ago. And what I find interesting now is that the computing power in the smartphones that we all have are more powerful than the computer used to put a man on the moon. So can we use that technology to move our agenda forward? I gave a talk last week in Los Angeles to the health and fitness industry, and I think they're a little nervous about this because there are more users of fitness apps than there are members of health clubs, by a lot. So people are relying on these apps more than they are relying on their personal trainers or their fitness centers. How is that going to disrupt that industry? Because 73% of the users say they are healthier today, they believe that they're healthier today, by using their app. Or this one, 69% of mobile health users think that tracking their health and fitness on their smartphone is more important than using it for social networking or for online shopping. We're seeing a change in how people are using their smartphones. 46% say that tracking has changed their overall approach to maintaining their own health or the health of another. So people are now using it to manage care for family members. % of trackers say that it has led them to ask a health professional new questions or to get a second opinion. And 34% say that it has affected a decision about how to treat an illness or a condition. These stats are impressive, and the technology is persuasive. But how can we make the connection and leverage these advances in technology to impact chronic disease and to improve health? Because the world suggests a different story, and then there is the rest of the story. Many of you are familiar with these. Obesity levels continue to rise across the country, across the world. Diabetes, the prevalence continues to increase. So I have showed you the statistics that say people are using their smartphones for health, but we still continue to have challenges. Consider the following. There's an increasing number of people with chronic diseases that account for a disproportionate percentage of overall health care costs. 84% of national health care dollars spent on chronic disease, 99% of Medicare spending. And the projections suggest that it could get worse. Nearly half of the U.S. population suffers from one or more chronic diseases, and by 2020, the number of Americans suffering from multiple chronic diseases is expected to rise significantly. I've talked about how users love the apps, but we find that providers are still a little hesitant. There was a survey that just came out recently that suggested that 16% of healthcare providers are using mobile health apps in their own practices with their patients. Half of those expect to use these types of devices within their practice within the next 5 years. So while the healthcare providers are well aware of the benefits, most are still reluctant to jump in. which begs the question of why. It goes back to, Bernard, the story that you were talking about in the New York Times. I just read it this morning. It's a very interesting article. And if you look at why people are using this technology, they're using it to track their health goals. They're using it to become more aware of health issues, even motivation. I'll tell you a story about motivation. As a personal trainer, I believe one of the reasons that the person is hired is for accountability. There is a weight scale that I have at home that's connected to the internet. It's called the Withings scale. Some of you may be familiar with it. But what the scale does is it connects to the internet, and when I step on the scale, not only does it get sent to my physician, to my electronic health record, but it also tweets my weight. So if you hire me as your personal trainer, and I give you this scale, and I say every Monday morning you're going to step on the scale, Bernard, and I'm going to find out your body weight, did I affect what you're doing over the weekend? And the answer, even if it's a little bit of a yes, then I did my job as a personal trainer. I've kept that person accountable. So that's where we can leverage these types of technologies. The Pew Mobile Health report suggests that there are lots of different groups that use smartphones to gather health information: Latinos, African Americans, ages from 18 to 49, and those with college degrees. But let's take it back to my dad. My dad is a retired high school teacher. I'm biased. I'll say he's well educated. But he has trouble typing on his smartphone. He has trouble when he leaves the house and loses connection to the internet through Wi-Fi to reconnect. So is there a way that we can help him manage his high blood pressure, manage the medications that he takes? I think the answer is yes. I was in the Bronx back in November, the poorest congressional district in the US, and I was speaking with a nutritionist there, talking about what she was doing with the community when it came to nutrition. And I asked her if she was using any of these mobile fitness apps, because if you do a food journal, you're able to find out trends and get information. So this is a report that you can see what you could get from all of this. And she said, no, I don't, because this is too much. And I said, can we come up with a solution? I said, what if we just took a picture of the food that the person was going to prepare for the family? And instead of bringing in a food journal, bring in a picture album of all of the foods that was prepared for that week. And she said, that's a great idea. And that's what they're doing now. They're taking pictures of food. And there may be people that graduate into doing something like this, but she was able to make a decision around using technologies, around using smartphones, by simply using the phone, not the app, to take a picture. The investment in this area continues to rise. Just looking from 2011 to 2014, you can see the dramatic growth. 2015, the $420 million is just January alone. In fact, if you look just up the street in Baltimore, Under Armour acquired two of the more popular mobile fitness apps for over $500 million. That's billion with a B. So why do you think Under Armour wanted to get into this space? Well, they made a business decision, and they want to be able to know what their users are doing. Their membership base now of users is now 120 million people. That's an amazing statistic. The fitness industry I mentioned earlier has 58 million members. So they've doubled the number of people that they can communicate with. There's a convergence of technology and health, and how consumers are getting their information and how they're using it to change their behaviors. Smartphone usage, tech-savvy users, peer-to-peer healthcare, and what I call the big three. 4 in 5 people now own a smartphone. I mentioned earlier, we're using it more and more on a daily basis. Tech-savvies, and these are seniors, are using smartphones for self-care. They're using wearables, and they're willing to share that information to track vital signs like heart rate and blood pressure. These seniors are going into communities like Patients Like Me for reactions to the doctor recommendations that they're getting before they act on it. The Pew Research Center has talked about this peer-to-peer healthcare, where the internet is giving patients and caregivers access not only to information, but also to each other. A forum to talk about their treatments. And what I like to talk about are the big three: Microsoft, Google, and Apple. They're coming into our space. Some say it's a good thing. Some would say that it may not be a good thing. If you were watching the Apple presentation a couple of weeks ago, you saw that they are announcing the research kit, which is allowing researchers like ourselves to go out and to collect information. Within a day of announcing this, one of these, and I think it was the Parkinson's disease app, had 10,000 people sign up to be part of this trial. How many people would love to have that sample set of 10,000 people? This is a picture of the Parkinson's, so monitoring the symptoms by speaking into the smartphone and sharing that information with researchers and to physicians. There are some challenges that arise because of this. One of them is privacy. Who owns the data? Who has access to the data? And what will they do with that data? We'll talk about that during some of the panel discussions later today. I'll share with you an example of the research that I did. So I collected over 7 million tweets over the course of a year, looking at people sharing their workouts online. So this is a tweet, 140 characters, and I could find out from that tweet a person's workout routine, the distance that they ran, the time that they ran, heart rate. But I could also tell where their running route was. I could tell what time of the day that they went. I could actually find out what music they were listening to at different parts of that running map. So the information is there. We just need to help educate the developers and educate the users of what is being shared. Here's an example out of the UK called Mappiness. Some of you may be familiar with it. From the London School of Economics. It was a simple app. It's been going on for a number of years now, where it's a simple push notification. And it says, how are you feeling and where are you? And they're collecting information and they're making a difference, and they're using that to spend healthcare dollars from the government on different initiatives. So they can throughout the UK monitor in real time how people are feeling. We couldn't do this years ago. We can now. Because you can't manage what you can't measure. And that's the phase of where we are now. We have the tools to be able to measure it. What we need now is to be able to come together and find a way to take the next step. One of the other challenges is the lack of standards. IOM came out last year with this discussion paper on designing health literate mobile apps. We'll talk about more of it today. This is an app called Gobi. It was a Kickstarter program, no, it's not a Kickstarter, Indiegogo campaign. They raised $1 million. They claim to be able to tell you what you ate the day before by monitoring what goes through your wrist, your blood flow. Now, I've never heard of this before, and I'm probably guessing many of you haven't heard of this before, but they raised $1 million because people want this type of technology to work. Here's an example of a place called PlushCare. Face-to-face meetings with your physician. Guess what? It only works in California because our current laws, if you are a physician in one state, you can't practice in another. So the FDA and Congress are aware of this, are trying to work on coming up with solutions for it, but sometimes, as I mentioned earlier, the innovation of digital health is faster than what we are used to, and the regulatory path is still a little confusing. So, to recap, we are in an interesting space. This area of technology is rapidly growing and changing, but there remains problems with access and equity. But there seems to be real potential here to make a difference in the lives of people, lots and lots of people, to live healthier lives. But this technology still remains unproven, and that lack of scientific proof puts sustained growth of this consumer-facing health technology at some sort of risk. People will ask if this is just another fad. So for the next 20 minutes of the question and answers, let's start a discussion about how health literacy can help create sustained behavior change in people's lives through these technologies to demonstrate the improvement in health status of those that use these types of tools. So with that, I will end my presentation. I'll come back to the table and we'll start a discussion on where we can move forward on this.